Lipedema sometimes gets confused with lymphedema, but lipedema is actually an adipose disorder in women, and it affects about 1 in 10 women in the US and probably that around the world as well. The thing about lipedema is that this tissue sometimes becomes stuck. It's like a fat or an adipose tissue. And these women have these pockets of this tissue that's tender. It's a pain disorder. They bruise easily, and it affects their shape. It is predominantly affects their lower extremities. So they're sort of have normal upper extremity in the rib cage, and then they have these abnormal fat deposits in their hips, thighs, and lower legs. So for me, it's empowering to be able to tell the patients, this is something that you have. It's affected your whole life. We all have skeletons in the closet, but these women have something that's very visual that people judge them by. And most of the women, they're so happy to learn that there's an explanation for something they've suspected their whole life. Sadly, we don't have a treatment for it. There's a lot of therapy, so I really do enjoy teaching them how to help manage it. And if the venous disease is part of it, it usually does help some of the pain that they're having. And those studies are ongoing now, looking at just that. It's been great to be on the forefront of something that affects so much of women's health care. And someday I hope that we can find the cause and the cure for all of these women. But I love just giving them a pat on the back because they've been dieting, they've been exercising, they've been doing all this that everyone has told them to do. And they truly usually do eat like birds. And these women are these thin little women that feel like they're wearing sumo wrestler costumes. And so I really just like to validate them and let them know that it is a condition. And that's part of my passion, is to help bring some awareness to this and be part of the team that helps find the cause and cure for them.